So how to detect the retrosternal space and its abnormality, and what are the three specific criteria of anterior mediastinal masses. So this is the normal chest X-ray. This is the ascending aorta, and this is the aortic knuckle or aortic arch. This is the aortopulmonary window. Here is the aortopulmonary window, and this is the descending aorta. Okay, so here this is a frontal chest X-ray of a 21-year-old man with exertional dyspnea. Okay, so there is a soft tissue density mass, as you can see here. A soft tissue density mass. This soft tissue density mass is obscuring this one and this one, obscuring the aortic knuckle and the aortopulmonary window. This is a specific criteria of the anterior mediastinal masses, because the aortic arch is an anterior mediastinal structure. So if obscured, this means that there is an anterior mediastinal mass. Next sign or next criteria, can you see this hilar vascularity? Yes. You can also, or you can still see the hilar vascularity through this soft tissue density. Okay, this is called the hilum overlay sign. Okay, this sign means that the hilar vascularity is not obscured by the mass, and this means that this mass is not a middle mediastinal mass, because the hilar vascularity is middle mediastinal. Hilar vascularity is a middle mediastinal structure. So if the mass does not obscure the hilar vascularity, this means that this mass is either anterior or posterior mediastinal mass. It is not a middle mediastinal mass. Okay. So next sign, this mass doesn't obscure the descending aorta or the paravertebral lines. This means that this mass is not posterior mediastinal mass. Okay, so this mass here is not middle mediastinal mass and is not posterior mediastinal mass. It is anterior mediastinal mass. Again, it is anterior mediastinal mass because it obscures, or it is seen silhouetting, the aortic arch and the aortopulmonary window. It's not middle mediastinal mass because it is not silhouetting or obscuring the hilar vascularity. It is not posterior mediastinal mass because it's not obscuring the descending aorta or the paravertebral lines. Now let's talk about the retrosternal space. On the lateral chest radiograph, the retrosternal space normally is filled at its inferior one-third or its lower one-third is filled by the cardiac opacity. However, it is seen clear at its upper two-thirds. So the upper two-thirds of the retrosternal space should be seen clear, and the lower one-third should be seen filled with cardiac shadow. The upper two-thirds of the retrosternal space should be seen clear. The lower one-third should be seen filled with cardiac opacity. So what about this? The lower one-third is seen filled with cardiac opacity, as well as the upper two-thirds. The upper two-thirds of the retrosternal space is filled with opacity, or a soft tissue mass. The trachea and the esophagus, okay, you should try to look for the trachea and the esophagus on the lateral chest X-ray, because before them you need to detect the aortic arch and the ascending aorta. After them, you need to detect the descending thoracic aorta. So before them the arch, after them the descending aorta. Here in this case, this is the trachea and this is the esophagus. I can see the aortic arch, however, I can see the descending aorta. Can you see the descending thoracic aorta? Yes. So the mass here is seen filling the retrosternal space. A mass, a soft tissue mass, is seen filling the retrosternal space, compressing the trachea. This is the normal tracheal lumen, and this is the compressed trachea with narrowed lumen. So the mass here is seen compressing the trachea, silhouetting or obscuring the aortic arch with preservation of the descending thoracic aorta. So this mass is anterior mediastinal mass because it is seen filling the retrosternal space. This mass is not a posterior mediastinal mass because it is not obscuring the descending thoracic aorta. The descending thoracic aorta, to be obscured, it needs a mass here. Okay, needs a mass here. It needs a posterior mediastinal mass. The aortic arch, to be obscured, it needs a mass here in the anterior mediastinum. Okay, the hilar, this is the right pulmonary artery. The hilar structures to be obscured needs a mass here in the middle mediastinal structure. Okay, so this is the anterior mediastinal mass. This is the preserved descending thoracic aorta, and here this is where the anterior mediastinal mass arises. This is the location where the anterior mediastinal masses arise, and here is the location where the middle mediastinal masses arise, and here the location where the posterior mediastinal masses arise. Okay, that's why the posterior mediastinal masses obscure the descending thoracic aorta, and the middle mediastinal masses obscure the vessels that are coming from the main pulmonary artery. So the middle mediastinal masses obscure the hilar vascularity. The anterior mediastinal masses obscure the aortic arch. So this is contrast enhanced CT scan of the same patient. There is a soft tissue mass centered within the anterior mediastinal mass because it is seen filling the retrosternal space. So it is centered on the anterior mediastinal mass. Can you see this? This. The mass is seen encasing the great vessels without compressing them. Here also, the mass is seen the mass is seen encasing the great vessels without compressing or obstructing them or invading them. Okay, so the mass also is seen exerting a mass effect on the trachea and the left main bronchus. Okay, so the mass is seen displacing and compressing the trachea and the left main bronchus. It is seen displacing the trachea posteriorly. Okay, why here I see the left main bronchus like this? Because the left main bronchus is horizontally oriented and it is longer than the right. The right is shorter and vertically oriented, so it can't be delineated like this. Okay, it can't appear like this. Here is the left main here is the left main bronchus is seen horizontally oriented. It is large, horizontally oriented. It is long, horizontally oriented, and is seen lying inferior to the main pulmonary artery as well as the aortic arch. Okay, so here the left main bronchus is lying inferior to the aortic arch. Okay, now what are the three criteria of the anterior mediastinal mass? Filling of the retrosternal space and obscuring the aortic knuckle. Okay, the second one doesn't obscure the hilar vessels because this is a criteria of the middle mediastinal mass. Doesn't obscure the descending thoracic aorta or the paravertebral lines because this is a criteria of the posterior mediastinal masses. What is the differential diagnosis of the anterior mediastinal masses? Lymphoma, thymoma, germ cell tumors. Lymphoma and the thymoma tend to affect the adult, however, germ cell tumors tend to affect the younger age, like teenagers or adolescents. So in this case, his age was 21. So lymphoma and the thymoma is most likely in this case because he is an adult. Germ cell tumor is expected in a teenager. Lymphoma is the most probably diagnosis here because the mass is seen surrounding the vessels, encasing the vessels without compressing them. And also there is another criteria of mediastinal lymphoma seen in this case. It may extend anteriorly into the chest wall. Can you see this? So the lymphoma posteriorly it tend to encase the great vessel and exert a mass effect. Anteriorly it tend to extend into the anterior chest wall. Okay. How to manage a case of mediastinal lymphoma? Okay, try to find an accessible lymph node, like supraclavicular or axillary lymph node, and try to take a biopsy or try to perform a nodal biopsy of any accessible lymph node. What about if there is no accessible lymph node? Okay, you have to take a biopsy of the mediastinal mass by image-guided fine needle aspiration and core biopsy. So if you can't find any axillary or supraclavicular lymph node to perform a nodal biopsy, you have to perform image-guided fine needle aspiration and core biopsy of the mass, of the mediastinal mass. So I think that's all, and thank you.